Morning, everyone. My name is Jason King, Programme Manager with Get Ireland Walking and Chair of the Woodlands for Health National Steering Group. Thank you so much for joining us today for the second national gathering of Woodlands for Health, this time around in virtual form. It gives me great pleasure today to reboot Woodlands for Health with friends, colleagues, stakeholders and participants of the programme. For the next couple of hours, we want to take you on a journey into the Woodland to explore the beginning of this programme, its inception, growth, and the people and organisations that make it happen. Today, we are joined by our main stakeholders, Quilta, Mental Health Ireland, Go Green, and the University of Maynooth. Many contributors and other partners on this programme make the programme a huge success. Joining us are the local sports partnerships who work at the grassroots level with participants, coordinating, building relationships, and providing support pathways to other programmes and activities. Other stakeholders here today include Sport Ireland, who have supported the programme through the Dormant Account Sports Inclusion Fund, Mountaineering Ireland, Healthy Ireland, the HSC, Mental Health Services, programme participants and researchers all here today and most welcome. As programmes begin to recommence at the community level, specifically in outdoor settings, we felt that Woodlands for Health needed a reboot, a refresh and a renewed energy to scale and implement in areas of need. Our agenda for this morning's webinar will start where we'll learn of the Woodlands for Health story with Martin and Charlie. Following that, I'd like to introduce you to a new web space we've created through Get Ireland Walking for visitors to learn more about the programme and highlight some downloadable PDFs to help you get restarted or start a new programme for the first time. We're delighted to have with us today a guest speaker, Dr. Eddie Murphy from RTE's Operation Transformation. Eddie will share his insight into walking and its benefit for our overall health and well-being, with an emphasis on nature-based settings. We'll take a 5-minute stretch break following our guest speaker and return for a panel discussion with national and local partners, followed by a Q&A. We also have some heartwarming videos to share with you to capture this programme on the ground, interviews with participants, ambassadors and scientists within the field. But first and foremost, some important information before I introduce the first guest. Just to let you know, we're recording this session for social media and web sharing. It will be available on the MHI and GIW website and on the MHI Mental Health Ireland, Facebook page. Our hashtags for today's event are Woodlands for Health Reboot or Woodlands for Health. We'll be most appreciative if you can share the tags across your social media platforms. And just to note, if you have any questions for our guest speaker or panel, please use the chat feature within Zoom at the bottom of your screen. Our background team will be picking up those and feeding them through to me. So without further ado, it gives me great pleasure to introduce you to Martin Rogan, CEO with Mental Health Ireland, and Charlie Burke, Recreation Officer with Quilta, who will take you through the Woodlands for Health story so far.
Okay, thanks, Jason. Really appreciate that. And again, just a huge invitation and a welcome to everyone who's joining us this morning. So, as Jason said, my name is Martin Rogan. I'm CEO with Mental Health Ireland. And we're a national organisation. We promote positive mental health and well-being, and we try and bring practical application to what we know is a really good evidence-based approach. And I suppose Woodlands for Health is one of those really elegant and really simple ideas. And sometimes the simplest ideas are the ones that are most difficult to explain because it's about an experience. And this morning we're going to take you on a bit of a pathway through the woods, using video with guest speakers and that to introduce you to the background, the history, and where we want to go next with Woodlands for Health. And we're really, really pleased you can join us for that. So when we're promoting positive mental health and well-being, I think it seems a bit intuitive, the idea of being out in nature, getting some exercise, meeting with some companions and going for a walk in the woods. You know, it just has an immediate rationality to it, to a perfect sense. And it just means that we move through our natural habitat at our own pace, and by itself, that's calming. But the fact that it's a guided walk, and so many different partners, we're going to hear from each of our partners this morning, have worked together to bring this about. Now, if you're like me, you probably grew up in a city where sometimes the closest you got to nature was something like this, which is one of these kind of things you hang up in your car and it smells of the woodlands. And that in itself can be evocative. But for many people, particularly if you've had a bump in the road, particularly if you've had maybe a mental health challenge of some description, which has probably knocked your confidence a little bit, just actually getting out there, reconnecting, rejoining, and particularly after COVID, I think a lot of people who've had to cocoon and probably be extra careful are now beginning to venture out again. So we wanted to create an easily accessible, free modality or platform for people to do that. And I think building on this idea, and the work of local associations and local volunteers across the country, Charlie Burke, I'm going to introduce you to now, happened upon this idea. And Charlie, you might just give us a little bit about your own background and experience and what brought Woodlands to Ireland.
Yeah, firstly, the programme Woodlands for Health was adopted from the Forest Commission in Scotland. They ran a programme called Branching Out, and we replicated ours and tweaked it to suit the Irish forests and the Irish people. I myself have a background in of bipolar disorder and have had some illnesses over the years. 9 out of 10 people who have bipolar disorder don't have jobs. So I count myself very lucky to have a job with Quilta, which is a strong, vibrant, semi-state forestry company. Quilta see this, what we're doing now at the moment is as a strong public good, what we do for Ireland and the people of Ireland. And it's a great pleasure to be able to see people go through the programme and benefit from it. In Wicklow, in excess of 800 people have benefited, and around the country we have 15 different locations where the Woodlands for Health is available. The programme itself is a referral programme, and the participants are referred by their treating team within the HSE.
So that collaboration between the HSE and each of the organisers, like you say, Woodlands for Health began in Wicklow, then moved into Dunleary, Rathdown, and now is extended to over 15 sites right across the country with hundreds of people participating, and more people want to participate. That's what today's webinar is about, to expand the idea, bring it to scale, and invite more people to become involved. But you're saying how we collaborate very closely with HSE Mental Health Services for people who might otherwise not have come across Woodlands Walking as part of the therapeutic programme.
Yeah, and Woodlands for Health is a partnership. The partnerships are very important. From my own background, I am somebody who used the services, the HSE services. I run Wicklow Mental Health Association, which is affiliated to Mental Health Ireland, and I work for Quilta. So right across those four partners, I'm involved with each of them. When the programme was scaled up to be delivered around the country, the model that we had was the Dunleary Rathdown Sports Partnership model, and the sports partnerships throughout the country lead out on the programmes in their individual counties. So the national steering group is Mental Health Ireland, Quilta, and Get Ireland Walking. So we deliver this around the country. It's a great benefit to people. What's really good about this is that Quilta have very many staff who are retired, and they are volunteers and walk leaders, and they tell people all about the nature and the forests, the flora and fauna, and it's all done very relaxed, and it's very relaxing, and the people on the programme get to ask questions and learn a bit about nature, which is that's good.
So like you say, there's a number of key partners who work together, and like people often associate Quilta with, timber and wood, etc. But there's also a huge recreational component there. And I suppose in Ireland, we're blessed. We've got some absolutely fabulous landscapes. And even in the winter, our climate lends itself to getting outdoors. It's just having the opportunity to do that. And obviously our key partners in terms of Get Ireland Walking, which encourages more and more people just to come off the couch. And perhaps during COVID, when it was a 2-kilometre limit, then a 5-kilometre limit, then a county limit, people began to get out a bit more and explore and really appreciate just the benefits of that. And I think what's really important with this programme too is that it's been well evaluated. It's not just a good idea, but actually the science backs it up as well. We know that people who participate have better sleep patterns, reduced reliance on mental health services, and also can move forward in terms of their own recovery, engaging with new pathways towards getting involved with your local community, developing new friendships. So there's many, many different iterations of it. And I must say the collaborations with the local sports partnerships, with volunteers, and with our development officer staff in Mental Health Ireland, has meant that it stays within the locality. So people build those friendships that are really protective and really supportive in terms of your mental health and well-being. And Charlie, can you describe in terms of introducing the Woodlands concept to new communities and people who maybe hadn't participated before?
Yeah, well, firstly, I'd like to say that the programme would never got off the ground but for the support of Creelta. They encouraged me to do this programme, and Mental Health Ireland funded the initial 2 programmes, and then we moved on to additional funding from other parties. Your question there again, Martin?
So in terms of the, like I say, a number of parties that come forward, like Sports Ireland, local sports partnerships, dormant account funds. So I don't think any one of these agencies could have really delivered Woodlands in its own right. But when you go to a new community who are interested or curious, some of the questions, and I know these will come up in the panel discussion later, but some of the first questions you're asked when you're inviting people to get involved in the Woodlands for Health. Yeah,
well, the referrals come through the HSE community mental health nurses and they refer the people to the program, and when the program begins, they're there on a weekly basis. They're there to support their people. They know their people. They know their background, and they have that strong relationship. Without that, really, the program wouldn't happen. So the referral pathway really is from the HSE, and then Creelta provide the walks, the locations, and walk leaders. Get Ireland Walking lead out on it, and they organise it in the local areas. So it really is something that's without any one partner, it simply wouldn't work. So does that answer your question, Martin?
I think so. And I think what's really important, I suppose, in Mental Health Ireland, one of the things we do is all of our activities and all of our programmes are developed in co-production. So it moves at the pace of the participant. It's not a route march. It's not goal-driven. It's a gentle educational opportunity to get out and get some exercise, appreciate our natural habitat. And there's a light lunch. And again, we've had diverse partners involved from local links and Transport for Ireland to make sure that people can actually get to the woods and enjoy that safely. Obviously, with COVID last year, that was probably the biggest challenge for us, is to do the transport component, to do that in a socially distanced way. So that's why we're now at the point of rebooting. We're looking at a new icon. We've got new resources, new materials, guidance and implementation, new website. And that's why today is so important. And we're really pleased that people can join us today. So we encourage all of the participants today to use the chat function. If there's a question, a query, and there's no such thing as a silly question, there might be a silly answer, but there's no silly question. So if there's something you're curious about, you'd like to know more, at the panel, we'll be bringing these questions through, and to our guest speakers as well. But I must say, Woodlands for Health, it's a really accessible and really enjoyable piece. Sometimes we overlook that in the whole area of mental health and well-being. But what encourages people to come back time and time again is it's great fun. It's really enjoyable. I was talking to a participant there last year, just before we had to wrap, and they were saying they were really looking forward to next Wednesday. And I said, oh, is next Wednesday your birthday? Is it a special occasion? And he said, no, next Wednesday is when I go out to the woods again with my buddies. Because they didn't really have a whole lot of social contact. They might not see another person or have a conversation, because they sometimes live quite an isolated life and sometimes a little bit withdrawn and removed. But Woodlands for Health creates a platform. It's an invitation, it's an introduction to re-engage, get involved again at your own pace, in your own comfort level. And it's not as a psychotherapy or anything like that. It's just the experience of being out with people and moving through the forest and enjoying that and every moment of it. That's the essence, and that's what we're going to try and convey over the next hour or more. Yeah. So again, Charlie, any finishing remarks there before?
It's all about walking and talking, making connections, and later on in the presentation we'll have videos with personal testimonies. And I think it's very important that people who are not always open to to give a testimony, because at the very outset, it's very difficult to get some people on the programs because they're shy. They really want to get out, but there is that little barrier because of their health. And then when they do get out, sometimes conversations aren't had until later in the program, maybe the second or third time. We did have a lady in our program in Wicklow who never spoke for about the first 6 weeks, and she brought a camera with her and she took photographs. And that lady went on to be very confident, and she her development was really unbelievable. She was a shy lady, and now she's outgoing and confident. So it's important that those parts, to see those parts develop. So yes, it's very simple stuff. Walk, talk, have lunch, connect, and you'll see later on in our presentation a number of people who are on our Dunleary Rat Down program and our Wicklow program who have been on television on EcoI and Operation Transformation. So for them, it's been a transformation.
So Charlie, I must say, for someone who's taken an idea that you spotted in Scotland, you brought it to Ireland, and it's been the generosity of sharing that, and that's an enormous achievement. And I must say, for Mental Health Ireland, we're really proud to be part of this programme, because working with the partners, it has created just so many opportunities for people to regain their confidence, walk, talk, chat. That's probably the simple essence of it. And you're going to hear later this morning this recommendation coming from a number of our speakers and presenters, everyone from our guest speaker, consultant psychiatrist, and even a former president, extending an invitation for you to get involved with Woodlands for Health. So I'm going to pass back now to Jason. And again, thank you for joining us today. We hope you enjoyed the morning. And certainly, if you want further information or you want to revisit this webinar or a lot of range of other materials, visit our website at www.mentalhealthireland.ie. And there's a lot of materials there, including additional information on Woodlands for Health. So, Jason, we're just going to invite you to come back in there. We'll pass back to you.
Charlie.
Sorry, Jason, just to say that we have a health and wellbeing page on the Creator website, and it's also available for those who wish to have a look.
Gentlemen, thank you very much. Thank you so much for that. Very insightful, and it's always great to hear of the story so far. I know, Charlie, yourself, you've been heavily involved through the inception and the idea and the concept. And I know you had mentioned that it was a program in Scotland, but to be able to take that idea, concept, and run with it in Ireland, it just shows the dedication, the commitment, as you mentioned, that multi-agency approach to delivery. And personally, from a Get Out and Walking perspective, we're delighted to be involved as well. Okay, so what I want to do now is just take you and the audience through a new web space we've designed for Woodlands for Health, specifically for Woodlands for Health, a place where somebody who wants to find out more about the program can log on to a dedicated space on our website and be able to download and interact with a Woodlands setting and all the PDFs and resources that are associated with the Woodlands program. I'm going to share a screen with you now. And so this is live at the moment. If you go to getoutandwalking.ie/Woodlands for Health, you will arrive at this screen here. The opening screen that you will see in front of you here just gives you some information on how to navigate the screen. And it basically just points at these controls along the bottom of the screen. You close off the first window here, and you may hear some birdsong starting to appear or sound across your audio devices there at the moment. So it's a full 360-degree footage of a woodland setting. And what we've done is we've placed these small little hotspots, we call them, in the form of leaf icons, which tell us about the background to the program itself, And I'll pick up on a couple of these in a second or so, and I hope that noise is not too distracting. What you'll see in the woods, the different flora and fauna, and not just for professionals or practitioners who want to start up one of these programs. It's also a resource for participants on the program who have gone through the program or are going to start a new program to come to this space and interact with the website. So I'm just going to pick up on maybe one of these links. So what you'll see in the forest, it'll bring you to a pop-up screen which gives information on different flora and fauna that you would expect to see in the woodland. Other documents include, and again, you can just use your mouse to scroll across the screen, types of resources. If you click for more info, it will take you to a dedicated page with a downloadable PDF. I'm just going to stop this share for a second because that bird song. Excuse me. I'll just turn off that bird song for a second. I'm just going to share a screen and just go through some of the PDFs with you. So on the screen here, and Martin had mentioned it too, it's a reboot. It's a reboot of Woodlands for Health. So what we wanted to do was really to refresh all of the documents, all of the resources that are directly related to this program. And the first thing we looked at was the logo itself. And a lot of you remember the last logo, which was represented by people walking in the woodland. But we decided to look, let's give it a reboot. Let's come up with something different, a different concept, and something that we can explain to people what the program is about. And that logo then represents all of the program and all of the concepts. So the logo concept really came from the idea of a group welcoming a person from a place of isolation. And I think when you see this in the logo, you won't be able to unsee it. The logo is a cluster really of trees on the left-hand hill, reaching out to a single tree on the right-hand hill. So you can see that, I'm sure. And then those lines sweep around and connect the group to the individual. The logo reflects that the woodlands have a dramatic and varied landscape, and that interrupts a person's isolation at home. When we're surrounded by four walls, not just four walls physically, but four walls mentally at times in our mind. And they're intrusive thoughts. And the landscape gives perspective to people stuck in that cycle of negativity. And the logo then is a nod, it represents native tree shapes that offer a bright, varied, welcoming forest, with that open canopy where light can shine in. And that mind maze that you look at and you see within those circular tree shapes, they represent the alluding idea of escaping negative thoughts and embracing nature. And I think just to note as well that our designer, just to know that our designer Trish Fox from Trish Fox Design, and just to acknowledge Trish for her work on this logo, I think it really represents the program and what it's all about. This first document here is an implementation document or a guideline document for anybody who wants to start a program, wants to find out a little bit more about the program, those key components within the program. And the document itself, it's a lengthy enough document, it's 27 pages long, but it covers absolutely every key component of the program, from introduction right down to clothing, weather, food, refreshments, etc., full table of contents and very interactive graphical representation of key features of the program. I won't go through it all, 27 pages long, but just to let you know that that's there within that web space, getirelandwalking.ie/Woodlands for Health, and that's all downloadable in there. Other ones we had mentioned there just earlier, the flora and the fauna that you're going to see within the woodland, and then some comments maybe from participants who have participated on the program, and just one-liners or one word. What did the program mean to them? Some said they were very grateful to participate on the program, and I think Martin had alluded to it there. They were looking forward to the next Wednesday. Was it a verity? No, it was something to get back out, back in nature, back with friends, back walking in a woodland, being close to nature, breaking down isolation, the relaxation effect walking in the woodland, that peace and quiet that people experience as well. Noticing different paths and where those paths would take. So that's all in there. That's all downloadable from the getoutandwalking.ie Woodlands for Health. It gives a little bit about information about the partners, who's involved, etc., and then about the evaluation as well, which we'll have a little chat about later on. So just to stop share for a second on that, I won't spend any more time on that, but just to let you know that that is live now. Woodlands for Health, getoutandwalking.ie, check it out, download those PDFs if you want to reboot your program in your local area, or if you want to start a new program. All the information you need is in there, and we're contactable, obviously, at the office too. I'm just going to move on now to our next item, which I'm very excited about, and it's our guest speaker. Our guest speaker probably needs no introduction, but I'm going to give it to him anyway. He's Dr. Eddie Murphy, clinical psychologist, an adjunct associate professor with UCD School of Psychology. He's a well-known TV psychologist, where his trusted style, practical, respectful, and hope-orientated approach has a strong solution focus. He has a passion and enthusiasm about well-being and the role that nature-based solutions play in promoting and enhancing well-being. Dr. Eddie Murphy.
Thanks very much, Jason. I really appreciate that kind introduction, and it's lovely to talk to you all here today. First of all, I'd love to get, can you hear me okay? If you can in the chat function, put a thumbs up or yes, just to make sure that the audio is coming through, and the panelists will let me know that that's coming through fine. And I'd love to know what part of Ireland you're coming from today. Yeah, I'd love to just let us know where you are. There's over nearly 100 people on the call, 87 or something. And so let's just find out what part of the country you're from. I'd love to know where you're coming from today. And I'm going to be talking for about 25 minutes or so, 20 minutes. And I want to give a sense that I remember doing some training before around when people come to therapy. Now, Woodlands for Health is not therapy, but some people come in and they're browsers, right? They're browsers and they're trying to figure out, is this for me? Could I lead out on something? And so I'm going to try and convince you in a nice way, and motivate you to become from a browser into a buyer and actually be really engaged in this program. Because I fundamentally believe that nature-based interventions have a really powerful role, and I hope to be able to demonstrate that. So I see that we've got people from Carlow, Kilkenny, from Kildare. There must be some others around the country now, and anyone in our Munster area. We'd love to hear about you as well, and the west of Ireland, of course, the lovely west and the north. Anyway, so don't be shy, folks. Let's see where you're from. We'd love to know where you're from. There's a Waterford person, Adesha. That must be Monaghan. Nice. So we have because there's 15 locations, and I'm going to be challenging too. I want to challenge the Woodlands for Health. This is a reboot, but there's certain components as well that I think everything. Like life, evolvement, change, taking contribution on board, and being challenged is something that is really powerful about how something can grow and continue. And I met Charlie from Quilcha, and you know, to take an idea and bring it over, and it's like a seed, and that seed grows and grows and grows. And I commend that legacy that Charlie has brought to us, because it's such a powerful thing, and we know that for people who are engaged in the program. My background is I'm a clinical psychologist, and more and more I've been in the last maybe eight years look at this whole area of getting out, eco engagement, the power of the green and the power of the blue, I call it. And later on, we Ty McIntyre from Maynooth University, who's involved in the Disco Green Routes, looking at how we can nudge people into spaces that can have very powerful health impacts. And in a way, you're part of that nudge, as it were. This power, the green, how the forestry, the fields, the physical landscape, the blue around our lakes, seas, and rivers, and it can have incredible health effects. I think about it as your head and your heart. In terms of our head, it can bring calm, restoration, peace, engagement. It takes us when you're walking through woods. I'm based in Portarlington, County Laois, and there's a whole new area opened up, the Derry Ounce Walk, and there's lovely lakes there, and it's a board Namona gifted it over to the community, and it's been the whole walking area has been developed out there. But when you're walking in the woods, what you find is you're sort of picking your steps, and you're not just sort of heads up walking. Sometimes you're looking at where you're going, and it's a good thing, because when you're walking in woods, your attention is brought to the now. And most people, when around their own mental health, worries are very future based. So if you're worrying, you're thinking about things that will probably go wrong in the future, or if you're in sad, low, regretful mood, you're often in the past. Whereas being in the now has a very particular powerful effect of taking you into the moment. And that's what one of the things, one of the factors that Walking for Health, Walking in Woodlands does. So there's a massive evidence base for this, because when we're surrounded by nature, in terms of our heart, in terms of our physiology, it impacts on our immune system, boosts our immune system. It reduces our level of cardiac reactivity. For example, before I was a psychologist, never even knew about psychologists in my 20s. I was a late bloomer into psychology. I didn't come up in that background, and I went over to the UK and I trained as a general nurse, and I worked in cardiology for years, and I dosed out thousands of cardiac medications for people who struggle around with cardiac illness. And what I found that there was a level of cardiac reactivity, and I did this in my health psychology masters. But what we know is that in nature, that whole reactivity settles down, moves into a different space. When I'm in this room here, I settle down. I developed the space so that I could settle down, because I know that I'm sort of reactive, and at times I need to get into a space of calm. And that's what walking in nature does for me. And that's what you can do for others in terms of you're supporting others. It's a shared enterprise between Get Ireland Walking, Sport Ireland, between Sports Partnership, between Quilcha, Mental Health Ireland, Maynooth University. So lots of different partners, lots of people bring good things. This is about inflating the pie, as it were. Because when you inflate the pie, you bring more people in, bring more, bring more people, create more creativity, and creativity creates energy, and energy brings people on board. And they're talking about the referral pathway and through mental health services, but I can see that this will open up, this will expand, because what we'll find, there's a whole phrase now called social prescribing. It's what people have been doing for years in healthcare workers, occupational therapists, and social workers, psychologists, and medics and nurses. They've been engaging people to do things outside of bigger than themselves, engaging, plugging in with different parts. And similarly with Woodlands for Health, I can see this becoming a growth area, because people, and I would encourage, maybe if someone is coming, that they can bring a friend with them if they want as well, so that it breaks that social thing in the start, that they're able to have a lead and a support. Because I know when I go exercising or training or engage, when I'm with somebody, I generally do it with my sister or a friend, that I get out, and that helps me get out, because there's a sort of a pillar situation there, scaffolding. They won't go if I don't go, and I won't go if they don't go. So I think that's something that's worth considering. So when you think of when I think of psychology, I often think of the 5 big emotions in our lives. And if you think of a child under 5, we have 5 really powerful emotions, primary emotions. Can you think what they are? Like, can you put them into our chat function? I'm really interested to know what you think are the 5 big emotions in our life. So think of a child under 5 and pop them in there, and let's see what you come up with. And I'm just going to have a quick drink of water while you're doing that. So pop them into that chat function and we'll have a look. Okay, so love, joy, and happiness is one of them. We put that into one part of the family. glad, bad, sad, and mad. Okay, well, we'll take sad out of that one, so we will. So we'll take sadness, and we've happiness, we've anger, we've fear, and the fifth one. Anyone got the fifth one? Normally, if I was doing this I'd have a little gift for the fifth one. It's the fifth primary emotion in our lives. But effectively, a lot of our emotions bloom from these emotions, including us sitting here. The fifth one is disgust. Okay, the fifth one is disgust. If you see how these emotions develop, so when sadness it gets problematic, it can move towards depression or bipolar. When anger gets problematic, anger is a normal emotion. These are normal emotions, every one of them. Anger, but when it harms others or harms things around us, then anger can be toxic, and it can be toxic to us. Some people are imploders, and some people are exploders, and some people are a combination of both. And so it's learning how to manage that anger and express ourselves in a healthy way. Love, joy, and happiness. I'm going to take that towards the end of the talk. Fear I really want to talk about, because you talked about shyness there, and shyness really falls back into fear. There's different types of fear can express itself in many different ways, around panic, anxiety, worry, phobias. So imagine now I have magic powers here, and I could put a spider where you're sitting, big spider, or I could put a snake where you're sitting, or a rat where you're sitting. What would you do? What would you do? All them now are running around your keyboard, or running around your place. What would you do? Pop it in there, put that into the chat function. But what would you do? So most people would be running, or they'd get out of the room, or they avoid. And that's the thing about fear. Fear always leads to avoidance. And one of the things is that supporting people who would really like to do this program, but they're a little bit fear, they're a bit shy, they just need a help to get over the first step. And that's why I think it'd be helpful if someone could bring somebody, or that and I know the facilitators, and I know that you would have little systems to break over that fear, to connect people, to really engage. Because this is fundamentally about engagement with people, engagement with nature, engagement with each other, and having positive engagements enhance our well-being. This is really, really powerful. But fear is always strengthened by avoidance. And if you're turning up to a program and you're going up into Woodland, and you do week 1, and you do week 2, and you do week 3, you're supporting something that's so powerful in terms of sadness, and you're really supporting people out of isolation and loneliness. I was on the National Loneliness Task Force. This is before COVID. And what we know is that COVID, or loneliness, significantly impacts on people's well-being, increases their immune system, increases their levels of stress, weight, alcohol intake, cancer, heart disease. They say loneliness is the equivalent of smoking 15 cigarettes a day. Imagine that. And imagine by a program such as this, you're impacting directly on people's connectivity with other relationships. So it's such a powerful thing. That's why I want to encourage this program to jump from 15 to 30 to 60. I wanted to be like the COVID bloody virus. I wanted to jump in big steps, so that we can have Woodlands for Health right through in every county in Ireland as a goal. And only you can make that happen. And the reason why I want you to consider this is because it has such a powerful impact on individuals. And in my work, I've been working with individuals who have healthcare workers who responded to COVID. And I believe that, and the work I've done now is I've taken them into a nature place and just done the walk, talk, and chat, just as Charlie said. And it just, in a way, it's not even therapy. It's just being out there with somebody, supporting them, but they're also being held by something more powerful than me, something of nature and awe and beauty and inspiring. And I'm in the Midlands. Remember, I don't have the sea beside me. So if I can find it in beautiful County Laois, in lovely Laois, then it can be found. And I know it can be found in every county in Ireland. There's places of beauty. And having a sense of that supporting individuals and supporting people in this post-COVID phase, I think we're into a place where it's even more important. And it's actually the simplicity of it that Martin Rogan talked about in Mental Health Ireland. It shouldn't be, keeping it simple actually makes this work. And don't necessarily make it simple equal something is low grade or not ambitious. This is ambitious. This is incredible, and it can be very powerful in transforming people's lives. And we'll see that later on. I want to talk a little bit about a couple of things I think for the program. I thought is really taking photographs on the program while persons are out or taking photographs. This can be really powerful because we know from an evidence-based, even looking at nature-based videos or not looking at the photographs can have a powerful soothing effect. So in a way, we vicariously are able to get the benefits of being out in nature. And I think having those, taking photographs and doing something very creative around that can be very powerful for group leaders. And those maybe stopping and taking mindful moments in the walk as well can be extremely powerful as well, because you can bring that with you. And one of the things, so it's not people are facilitators. They're peers. They're walking with somebody. And one of the things around mental health is for years in clinical psychology, we've always asked, or we're often asked, what's wrong with this person? But only in the last 30 years, we've been asked, what keeps well people well? And this brings us into the whole area of positive psychology, looking at pleasure, meaning, and engagement. And if I had the power of me today to take a 99 cone, and you can have sprinkles and a flake in it, and I know there's a bit of a shortage of flake, but I've got this, and I'm giving you this cone, and I'm giving it through the magic power of you're enjoying it, you're savoring it, you're having pleasure from it. And in a way, having pleasure, meaning, and engagement is a really powerful thing in our lives. Now, if I gave you a second cone, or if I gave you a third cone, that pleasure would reduce. But having meaning and engagement is something that actually I believe acts as a dynamo to our mental well-being, to promoting positive mental well-being, having passions in life, having opportunity, and bringing individuals into nature and revealing that through the Quilty Walk leaders, revealing what's more around you and opening it up and finding something bigger than ourselves. So what we know is that to find that dynamo in our life or that passion in our life, some people find it through education. Some people find it through awe and beauty and nature and spirituality and things that are bigger than themselves. Some people find that through self-practice, such as gratitude, loving kindness, mindfulness. Some people find it through social justice, being good to others, actively supporting vulnerable people or supporting anybody to a place of well-being. So this is what you're doing. You're doing something bigger than what it seems. It's simple but complex. It's simple but impactful. It's simple, but it's actually creating change in a person's life. And you can do that because we need leaders to do this. We need people to be supportive, engaging, connect with others, and to just see that you're actually just opening a door into nature for people, and nature will do the work. Don't see it as you're taking on a therapist role. You're taking on roles that may activate your fear, but no, you're just being you. You're just being yourself, and through that, you're inspiring others. You're motivating others. You're reducing isolation. You're impacting on people's well-being. So I really appreciate you attending our webinar today, our Reboot. I think this is going to play a key pivotal role in post-COVID recovery for many people. And it's not just mental health service users. This is for a population base. I would see this for people who have struggled because of COVID, the hidden iceberg, not those that are attending services, but those that are at home, those that need some support to get out and connect. And I think this is a really powerful program, and you can play a huge role in this. And thank you very much.
Eddie, thank you so much.
Thank you, Jason. Really
that was very insightful. Very insightful. Makes me want to go for a walk in a woodland, and I'm very lucky to have one close by. It's not a big one, but it's somewhere where I go, just to ground myself, from time to time. And I take the dog down there, and he has a little dip in the water. And just like you said, it's really, really about keeping it simple. And this program is very much a referral program, and that's fair to say. But I think each and every one of us, and you've alluded to it there, we need to do this. We need to do this more. And I love. I just made a note here. The two things that really stood out for me there was keeping it simple, and nature will do the work. Nature will do the work, and it's not up. We're not here to try and change. We're just facilitators. We take participants to a space and let that space do the work. And I really that was lovely. I think that encapsulated it really well. I have a question, Eddie, if that's okay.
Oh yeah.
The question: how do we encourage a friend or a family member to participate in?
Well, I think this may if a referral comes in, that the person can bring somebody with them, and I think that will enhance it. It's like Velcro, right? So like it's Teflon and Velcro. Some people, right? So sometimes negative thoughts are like Velcro. They can sort of stick with us. And where we want to try and create a Teflon approach to negative thoughts. But for bringing friends with us, we want a Velcro. And I think it's inviting people saying, why don't you consider bringing someone with you? And because that will enhance the likelihood of continuation of that person in it. Because they'll obviously select somebody that they'll want to come with them.
Absolutely, and I think look, it's that buddy approach, and I think hopefully I explained it through that logo or refresh logo earlier on, that the Woodlands for Health program is very much a welcoming program. It's welcoming of everybody. Obviously, it's directed towards those who are having mental health challenges at this point in our life, and we're all going to have. We're all going to.
But what I think is going to happen. This is where I actually think it'll move that GPs will do a referral in. And public health nurses will do a referral in, or that, and then see the value of the program is, and one of the real values is at the end of the 12-week program, people are there's community walking programs through Get Ireland Walking that people are linked into follow-up walking, and you see, walking is the best medicine. There's no doubt about it. Like if you run, you're going to pick up injury. I try and run, getting less than running now, but more. But what we know is that if you could pocket in a pill what walking does, you would eliminate at least 20% of a huge amount of problems that people would have.
Yeah, absolutely, 100%. But I suppose the challenge is for those who are experiencing, the mental health challenges, to be able to pick themselves up off a couch and to be able to tie up those laces and step out the door.
Motivation can be a concern, and that's where the program is promoted in a way, and not often it's nudge. It's sort of side by side. This is a shoulder to shoulder, because if it's done like, listen, this is good for you, I recommend this, I'm going to prescribe this for you. Mm-hmm. That's, to me, just not the bit. Whereas I think, you know what, I'm going on a walk here, I'm going on Tuesday. Would you consider coming with me? I think, do you want to bring somebody with you? And we're going to meet here. And that sort of low sort of a way, sort of a peer way of introducing it. This is good for me, and it'll be good. I'm sure it'll be good for other people, and because I'm sure it is good for the leaders as well. Actually, here's one of the things we know from evidence is that when people volunteers receive more than they give. They actually get more than they give because they get a really powerful response to the fact that they're volunteering.
Yeah, and I've witnessed that. I've attended a couple of the Woodland health programs in Wexford and had a chat with the participants and walked through Tintern Abbey actually down there. It's absolutely beautiful place. And just to have a chat with the participants and ask them how the program is going and how they feel, and they, even relaying the information. I was very quiet on the first week. Wasn't really into it. The second week, I started growing confidence. By week 4 and 5, they're chatting and they're moving up and down the line, talking to different participants on the group. So it absolutely works. Eddie, there's a few more questions that jump in here.
One of the things is,
while we have,
but one of the things, Jason, I'll just reflect is, it's almost, you're on a winner when people are coming out for a walk, not when they're coming out to do a program.
Yes.
That's, when you notice the difference. When people are going, oh, I'm walking on a Wednesday, rather than I'm going for a program. Does that make sense?
Yeah, absolutely makes sense, Eddie. Question here from Carmen. What if I live in a city that's far from nature? What do I do then?
Well, first of all, the Woodlands for Health, that's a challenge, is to identify programs within cities, like where nature-based places within cities. I mean, it's a problem how we are designing our urban areas now without play places and stuff like that. But I mean, if you're within the city that I know of, any city I know of is near the coastline. So if you're in Galway, or you can go down to you can get a bus, or Dublin has a coastline. So any of the cities I know, Waterford is a beautiful coastline. The water-based walks near the city, I think. So I don't think it's exclusionary that the person is living in a city. Personally, I don't think it is exclusionary. Now, that's the challenge around. And one of the things is, with the program, they've identified in each county where the walks are going to be. There's a transport component to this. So it takes out the pain, as it were, that it facilitates walking around the area. So you're not thinking, but if you're looking to identify places if you're a volunteer and you're thinking you're living in the city, but you'd like to bring people in a walk in the city, you're going to have 12 walks, as I understand the program. There's going to be transport. If you're then get those people that are going to be doing that walking, you'll then identify those places, and Get Ireland Walking will support you in identifying the places.
Absolutely. I think that's really important. Somebody else shoots in. Are there any exercises you would recommend to do while walking to support our mental health, breath work, etc.?
Yeah, well, I think so. If you're within it depends how. Definitely stopping and taking notice, and taking notice of the environment that we're in, and taking it through all our different senses. What we see, then maybe closing our eyes. What we hear, what we're smelling, what we're touching, what we're feeling. For some people, they might be brave and they might want to take off their shoes and just sort of plant and connect in a barefoot way. For some people, during rain or something like that, they might just want to feel that rain. Because quite often, one of the things I know about Ireland and walking and stuff like that is people often put their head outside the door at the start of the day. The weather changes in Ireland every day. You rarely get a full day of rain. There's always gaps, right? And they always say there's no such thing as bad weather. It's bad clothing. And maybe I think that's sort of the thing, actually, from sort of running and walking and being an operational transformation over the years, is people might be a little bit out of touch with what's good clothing for climate. Quite often people put too much when they're going walking, they put too much heavy clothes on, and sort of whereas there's really fantastic clothing now. But actually, some people aren't, maybe because they haven't been active throughout their life, or this is a new thing. I know from OT, I would say, like as a man, from chaffing or something like that, that wearing skins can really stop you chaffing. Having good socks can really, when you're going, because sometimes I look at people that have toweling socks and stuff like that, and if they're going walking, so having really good footwear. I'm not saying to go out and buy a new wardrobe or stuff like that, but I think maybe something like what's good clothing can really help people get out the next time. But often I find when people are walking, they're maybe they have too much clothing on them.
I suppose that's the beauty about walking, and you spoke about it earlier on. Look, it's such an accessible form physical activity. We live on an island. We live on an island. It's called the Emerald Isle. We're surrounded by green space and blue, and I think you alluded to it earlier on. And I think it's important to note that blue space, green space have similar therapeutic, if not equal, therapeutic effects. And most things are accessible either by bus, the car, or just to open our eyes a little bit more to what's around us. And I think the pandemic over the last year and a half or so has really opened up our eyes to what actually is on our doorstep. More people are walking. More people seem to are now sustaining that habit. And for me, very much walking is a lifestyle. You know, that but before we were planning to go out for a meal, which is fantastic, or a drink with friends on a Friday night. Now we're thinking about where we're going to walk on Saturday or where we're going to walk on Sunday. And we're doing that with friends. So it's very much a social program. And I'm hoping that what Woodlands can help, what Woodlands for Health can do is to provide a platform for other similar type programs, whether they be walking, you know, cycling, swimming, whatever it may be, but outdoor activities, outdoor recreation. And that, like local services, you mentioned social prescribers earlier on, and we work closely with some subscribers in Get Out Walking, and the work that they do to be able to reach out to those individuals that we spoke about that can't get off the couch or are struggling to get off the couch, that maybe just need that, you know, that knock on the door to say, how are you doing today? How are you doing today? And would you like to join a social walking group? Do you know what I mean? And it may be down the road that these programs are watered down, and watered down is probably the wrong phrase, but a watered down version of Woodlands for Health. Very much social programs, very much nature based.
I think maybe just to drop the program bit, because the program is important. The program is important to the organisers. I get that, but would you like to go for a walk? You know, you mightn't realise that you're in a program.
Yeah,
it's like men's shed. You know, you turn up and you have a cup of tea and you make something or whatever, or and it's sort of that's the beauty of what you're doing. I think it's
that's the hook, isn't it? That's the hook. The hook is come for a walk, and then when you go for a walk, you naturally talk. And when we talk, those barriers start to break down.
I think the photograph is a good one, that you stop or you encourage people to take some photographs, and then maybe at the end of it, you collate these photographs and you put it into a collage or something like that. And then use that as something that, like, maybe gifting it back to each member of the group and say, this is some of our memories from our walk. And you can always have those trigger points, you know what I mean? Or what would you, I think that on the website, the new website, where it talks about what did you feel, and some people put, I felt calm, I felt connected, I felt comrade. So even in that, like, I'm thinking of like putting something like that together on what words would you use, and then you could maybe write them out, and sort of you could have like a postcard and say that you could, or people could take a picture or something and say, this is what came up for people over the last number of weeks, and just some words. There might be supportive person in a point when they may be low or something like that.
Yeah. I think those images, and as you said, it's rooted in evidence that they can have that therapeutic effect. You go to a place, you go on holidays, you visit a beautiful area. Vistas are fantastic. You take a photograph, you look at that photograph 12 months later, and you're taken back to that place almost automatically, instantaneously. Eddie, we're going to have to leave you go for now. We've just a couple of minutes left, and I just want to wrap up. We're going to have a little bit of a stretch break. But on behalf of the Woodlands for Health National Steering Group, we thank you for your time this morning. From all the partners here, from all our guests, it's been a pleasure to have you on. And I love that space that you're sitting in out there. It seems to be brighter in Kildare than it is in Waterford this morning. But I'm definitely going to get out for a walk in the Woodland over the weekend. Eddie, thank you so much.
Best wishes to everybody on the programme. Thank you.
Thank you so much, Eddie. I want to introduce first to you a short video. Now, this video was produced by RTE for RTE's EcoEye. And it was also showcased in Operation Transformation. You may hear Catherine Thomas's voice coming through on the voiceover. And this video really encapsulates the positive outcomes of Woodlands for Health for participants and partners. Enjoy.
Mary Byrne has always been very open about her struggles with depression.
I come across as being very bubbly, but I do have emotional upsets and I suffer with depression. The demons are always there. It's like they blindside me. They make me believe that I should be doing something else. Always looking to better myself is what keeps me demons at bay.
Research has shown that engagement with nature has very positive effects on mental health and well-being. And a few weeks ago, Mary went to find out more about Woodlands for Health, an initiative set up by Charlie Burke of Quilcha 5 years ago, based on a successful Scottish programme.
Charlie, what inspired you to set up something like this?
It came from my own background. I bipolar disorder. It's a very lonely place to be when you're not well. We started off in Avondale and on a weekly basis went out and walked and talked in nature. And what's better than nature? Walking and talking, they're two natural ingredients that go together, but sometimes people don't even think about it.
Charlie's Wicklow initiative has been adopted by the Dunleary Rathdown Sports Partnership. And today, Mary is joining some participants and supporters on a trip to the Dublin Mountains. The walks can be adapted to suit any fitness levels, but despite her arthritic knees, Mary has decided to take on an uphill trail, with a little help.
I feel like a wally with two sticks. But listen, if it gets me to the end result, that's the main thing.
And tell me a bit more about the walks.
The walks, we meet every Thursday morning and we go to different places, different woodlands all around Wicklow. And we go for about 2 hours and then we come back and we have a cup of tea and a chat. It actually gets us up in the mornings and stops us being sort of socially isolated, which is a big problem with mental health.
You're sort of out with a small group of people who you're sociable with, who are going through the same experience as you are, and you're getting to see the beauty of the woods and the nature. It's almost like kind of being in a stuffy room and you open a window to let in a bit of air. It kind of has that kind of effect, I think, for a lot of people.
The woodland environment is a very pleasant place to be. But as Mary discovers, the act of getting out of the house and into nature can have a profound effect on those taking part.
I've been depressed for a very, very long time, and a lot of that part was in denial. Things started going rapidly downhill. Last November, I took a major overdose and I ended up in Vincent's. And I realised then that...
That's when you're at
And
rock
that's when I
bottom.
realised. Then in March, Dr. Brophy asked me to join the walking group.
And how do you feel now that you do the walk? When you do the walks, how do you feel?
The friends I've made through the group, in that for the first time when you're walking in the woods, you feel secure, but you also feel there's people who understand what you're going through. And you're not alone, and that brings me to tears half the time. It's when you're with the walking group, it's your time and your time alone with the group. It's like for me to be able to admit that, yeah, I've been depressed for such a long time.
And it's okay.
And it's okay to say that.
Yeah.
And to go, yeah, I have been, but to know that it's going to get better.
That's what I'd like to hear.
Walking for mental health, it improves mood, and in particular releases positive emotions such as joy, awe, reverence, and happiness, which are very important and helpful. It lowers anxiety and boosts self-confidence and self-esteem in a way that promotes positive engagement with life's challenges.
I have schizoaffective disorder. There'll be elements of schizophrenia mixed in with a bipolar-like disorder. My daily struggles would have been mainly my paranoia, thinking that, you know, everyone's talking about me, they're talking badly about me. I found that when I did the Woodlands for Health, that the improvements in my life were medication reduction, which was huge, is that my social skills have gone right up, like I'm not as nervous around people anymore. Basically, I just feel like I have something to look forward to now in my future.
Last year, the project was evaluated by the HSE and University College Dublin, and the results were very significant. Participants improved their mood by 75%, sleep quality by 66%, and in addition, suicidal thoughts declined by 82%. For Mary, today has been an inspiration.
I feel very honoured to have met these people. They're very inspiring. They sat with me and told me their stories, which it must have been very hard for each of them to do, but they gave me self-worth in me by listening to them and gave me the courage to want to go out and do more. Thank you for inviting me.
We know that these programs are almost universally beneficial. For many, they're life-changing. But for a few, they're actually life-saving.
Wow. Yeah, I watched that video. I hope you enjoyed that. I watched that video numerous occasions now, and it's still like I can say it just pulls on your heartstrings, you know. And what's really coming across so strongly, I was trying to pick words out there as we were going through. Honesty, you know, that we're honest with each other when we talk, and we're open, you know, and we're not non-judgmental. I think that's really important. Inspiring was something else that came across really strongly there. They were inspired by other people on the program, and inspired to be in nature, and self-worth, you know, self-worth, and it's okay not to be okay, you know, and we're all going to struggle in our lives at some point. And to know that other people are there and there's that shoulder to lean on, I think that's hugely important. I think that's a lovely segue into the next topic on our agenda, and it's time for the panel discussion. I'd like to introduce a panel to you. The panel will be some new faces we haven't met this morning, and some who we have. Coming on your screen now is going to be Liam Cantwell, Development Officer with Limerick Sports Partnership. And Liam has coordinated and supported Woodlands for Health programs in Limerick. We have Miffy Hode, who many of you may know, Development Officer with Mental Health Ireland. Dr. Toyd McIntyre from Go Green Roots and the University of Limerick, who's been heavily involved in the evaluation of this programme. And Martin Rogan from Mental Health Ireland, and Charlie Burke from Quilta, who you've met earlier. Could I also just at this point maybe extend an apology on behalf of a programme participant who we hoped could have joined us today, but unfortunately we couldn't make it due to unforeseen circumstances. So just asked me to pass on our apologies. And just to note as well also that the panel, any questions for the panel, drop them in the chat utility. You know where it is now, and the background team then will feed them into me, and I'll present them back to the panel. And just to also say that we have a webinar survey link in the chat box, so we'd be most appreciative if you can fill that in. Obviously, it's of huge importance to get that feedback from yourselves about the programme today and how we can help you to maybe restart, reboot, or start a new Woodlands for Health programme in your area. Welcome all.
Thanks, Jason.
Are we all good for sound?
So?
All good, thanks.
Wonderful. I'm just going to open up this panel discussion, and look, you've all been part of what's going on here this morning, and the sharing, and you know, this question is open to all, and please anybody jump in. You don't need to talk over each other, but this program has multiple partners and stakeholders. And talk to us a little bit about collaboration. We've heard that word this morning, and I hear a lot about collaboration, but effective collaboration around Woodlands and this multi-agency approach to program delivery. Talk to me a little bit about that for a minute.
Well, the role of the walk leaders is very important. There's a combination of Quilta staff and retired staff, and also rangers in the Dublin Mountains. And then there's the people themselves who work well with the sports partnership. Some of them move on to do other programs. So collaboration in that sense is very important.
Anybody else? Thanks, Charlie.
I think what's worked really well, I suppose that none of these agencies, South Ireland, Get Ireland Walking, Quilta, etc., could have done this on their own. So you're bringing in different expertise, different energies, and then just in terms of just the vibrancy of participants themselves and indeed volunteers. And again, for people who are interested, you can contact our development offices through Mental Health Ireland, but you're bringing together different viewpoints, and also our partnership then with Newt University as well around the evaluation, just making sure that the program is still working, that we can improve it. And with the reboot, we've introduced some new innovations as well, just to keep it fresh, make sure we're learning from that and sharing the learning across all the different sites. And I know, for example, Miffy would have introduced a number of innovations as well around, say, when people are taking photos, just a simple little respectful piece saying, just make sure if you're taking photos going on social media, maybe just to check in with other participants as well, see that people are comfortable with that. And even just those little mindful moments that take place as well. And Miffy might want to describe just how that's really enhanced the program as well.
Yeah, thanks, Martin. I suppose the beauty of this is that we have the national sort of program and a steering group managing that, and then we can, down in our local areas then. So as a development officer for Mental Health Ireland, I can support the local, and my colleagues around the country, can support the local rollout of programs. And I suppose, last year, actually it's the year before now, of course, we've got pre-COVID and post-COVID, sorry, my brain is but in 2019 we rolled out Woodlands in Cavan, for example, and part of my role there was to support the rollout of it, but also on the first day I facilitated just a short little session with the participants around taking ownership of the program, kind of developing some agreements, if you like a group agreement. If you were having a training day, that we're all kind of on the same page around. Some people may have concerns about the speed of the walk. What if I can't keep up? So we agreed as collectively that there'd be maybe two groups, if you like, two paces, so that the people who wanted to plow on ahead could. And then maybe people who weren't so comfortable with that pace could drop back, and that there'd be people supporting them in that. And as Martin says, like the stopping to take photographs of nature is a really powerful boost to our well-being, and it keeps you very present and focused, and it's lovely to reflect back on them. But equally, if you capture somebody in your photograph, and if you're going to share that on social media. So we made this agreement collectively, and everybody agreed that nobody would share a picture of anybody without their consent, or maybe just have that rule. And again, pausing to take mindful moments during the walk, just to listen maybe to bird song, or just to, the scent in the woodlands after it's rained, that lovely kind of smell of it that's very unique to Woodland, just pausing for that sort of thing. And the other part is too that that maybe I would attend some of the walks and just walk and talk, as Charlie said earlier on, just that walk and talk, and you could talk about all sorts of things. I remember having a lovely conversation with one of the participants in Cavan just about our kids, and parenting and all of that stuff, and it was just a lovely relaxed conversation, but there was a connection then between us, and the next week it was like, oh hi, how are you? And so I think that's very powerful. But from the perspective of Mental Health Ireland's involvement, that having that person on the ground, so the development officers around the country are, an additional support to the rollout for the sports partnerships and for Culture, and having a local walker, leader like we had Noel, whose surname I can't remember, but Noel is local Culture retired Culture forester here, and he knows all about the history of the various woodlands and various ruins within the forest maybe, and he'd be able to tell you all about, who lived there and what happened. And, so it's there's so much more to it than just going for a walk in the woods. So yeah, it's powerful.
Yeah, and just to even pick up the multi-agency, like there's no one owner of this program. And I think that's the beauty about it. And I love working like that. It's everybody contributes. We're just cogs in the wheel for the end, for the overall, the best outcomes for the participants. But we gain individually and as organizations, from being involved in these types of programs. And it's more of these programs are needed at a local level. And I'd like to get just a perspective maybe from Liam from a local level. We're national partners. Liam operates at a local level. Yes, they're governed by Sport Ireland, but they're down on the ground. They're at a grassroots level. So from your own perspective, Liam, where does this program fit with sports partnership ethos? It's not necessarily sport. Yes, it's physical activity. And I suppose we're here today as well to reboot the series. But while we're rebooting this our series, this Woodlands for Health program, it's undoubtedly going to be scaled as well. So what are the key components on the ground from a local perspective that can make Woodlands for Health sustainable?
I suppose I'll take the first part of that first, Jason, in that where does it fit with the remit of the local sports partnership? I suppose, look, we're all about providing opportunities for physical activity. It doesn't necessarily need to be sport. So Woodlands for Health gives us a lovely walk. I won't call it program based on Dr. Murphy's piece, but it offers an opportunity to provide a lovely walk for people, for a vulnerable population. It offers us an opportunity to create partnerships with local services, particularly mental health, community mental health services, where other programs just don't allow us to do that, to target individuals. I suppose sport and physical activity now has gone to such an extreme that we're measuring distances, we're measuring times, we're measuring repetition, and that can be off-putting for a lot of people, whereas the Woodlands for Health walk is just literally, as everyone has said this morning, it's about turning up, it's about having a walk, and it's about having a talk, and it's about going at your own pace. And if you walk a kilometre and you want to sit in a bench, then someone from that group will sit beside you and chat it out with you until you're ready to go again. And that's the beauty for me of the program, is its simplicity and its easygoing nature. We're always trying to increase participation across the target groups we work in. The Woodlands for Health is a lovely introductory program if people do want to get on a fitness journey, starting from a place of where they may not be too physically active. But the Woodlands for Health gives you a nice 12-week introduction, and then maybe at the end of that to signpost participants onto other walking initiatives or other physical activity programs that would be suitable for them. You've already helped to break down barriers. You've already helped to ease fears and anxieties about participation in physical activity. So that can be, I suppose it's a massive step forward for people, and it encourages them. They've completed 12 weeks. They feel they can go on and do more. Coming then, I suppose, to your key components on the ground part. Look, it's again, it has been said all morning, it's about local partnerships. It's about accessing local partnerships that are there. And I mean, look, we all know mental health difficulties are common in Ireland. And what I found, I suppose, from trying to do the best that we can in terms of the rollout of the program, is that we had a bus company that supplied us a really good rate for our transport, because the guy that owned the company had his own personal experiences with mental health difficulties. Similarly, with a local shop that provided us with refreshments free of charge for after the walks. Again, same story. Someone had a family member who experienced mental health difficulties. So, as I say, it allows us to make those connections with the mental health services, with volunteers, with all the multi-agency approach, obviously, that we've spoken about, Quilta, Get Ireland Walking, and Mental Health Ireland. But I suppose, look, the biggest connection piece on that, and the key component, is that you're introducing local people to local facilities that they may not be familiar with. So the way we've rolled out the program over the years is we do a couple of venues at the start. We're lucky enough in Limerick that we have a couple of woodland areas in close proximity to the city. So we might do 3 or 4 different venues, and then we let the group decide which one they prefer, which one they'd like to go back to the following week. And I suppose we get good buy-in, and it's a good way of generating a bit of chat among the group as well, and creating a sense of ownership for the group, that they're deciding where they're going for their next walk. It's not being forced upon them. It's not right, herd it into the bus and we're taking you off. You don't even know where you're going. The decision has been made as a group. And then I suppose, look, there's the legacy of connection that it leaves. It's about participants meeting. They might be accessing the same mental health service, but have never met each other because they're coming in on different times at different days. And all of a sudden they meet at a Woodlands for Health walk, and they have a partner to go walking with on the Thursday if the Woodlands for Health has been on the Monday. So it's the legacy of connection for us as an organisation, with services and with other agencies, but it's also the legacy of connection for participants with each other, but also with the local amenities and facilities around the place.
That's really, thanks so much for that, Liam. I think you captured absolutely everything there from a local perspective. And the one thing really jumped out at me there is, it's far mixed abilities. You don't have to be walking 10,000 steps a day. You don't have to be walking at a specific pace for a specific distance. And the one thing you said there, if you have to stop for a rest after a few hundred meters, whatever, on a bench, someone will be there to sit beside you. You know what I mean? It's back to this shoulder to shoulder, walking and talking. Does anybody want to just pick up on that, on Liam's points there? I know that's from a local perspective, but from a national perspective. Sorry, yep.
Jason, look, I think it's actually wonderful, in the time we're in, let's just optimistically say, hopefully post-COVID, that we're talking about local people coming together to address global problems. That's really what we're talking about, because by doing this type of sustainable activity, bringing people to nature, we're actually addressing the larger issues around climate change. We're going to areas, of bespoke, wonderful nature, curated by Coillte. And what we're doing is we're giving people that connection to nature, which, it gives people more meaning in life. That's one of the psychological processes we're looking at. But I just love the idea. It's kind of like the structure of a forest. We got the boots on the ground, whether it's the client users, whether it's, the LSPs, whether it's Charlie and all the staff on the ground. And then we kind of got the mid layer, which is a kind of the mid growth, the bushes and the place for habitat for animals. And that's where, we have the support structures. And then we've the kind of high level, organizational support for this, which comes, as we know, from the very top of Coillte, from Imelda Hurley, the CEO, comes from Una May in Sport Ireland. It comes from Mental Health Ireland. Mental Health Europe, for example, are very much interested in this model being applied elsewhere as well. And I think there's a real sense of community around it. And I think that word is actually, very much a part of what we do in Woodlands.
I think picking up on that word community, and you described it really well there, because there's a huge sentiment, particularly over the last number of months. It's been a difficult time for lots of people. So people want to help, and they need to have some way to manifest that. So like you say, local transport companies, local stores have kind of provided refreshing snacks and that. So oftentimes in the mental health space, and sometimes the services are so discreet to be almost invisible. So it's about building those relationships. So you don't need to introduce yourself to someone in a crisis. You actually already have that done proactively. So it's about being part of your community, feeling valued in your community. And I say there's a lot of goodwill out there. People are always looking for, well, I'd like to contribute something, but I'm not sure what to do. So our national strategy that we're updating later this year is called From Ideas to Action. So lots of people want to help, and this is a really good vehicle for someone who wants to get involved or make a contribution. But I say without the local sports partnerships and that, absolutely embedded within the community, we simply couldn't make this happen. So that's a really powerful input to have as well.
And I think, sorry, Charlie, yeah?
Yeah, it's grown in recognition, and at a local level, there's many bodies that want to attach themselves to us. In Wicklow, there's the Wicklow Lions Club, the Wicklow Rotary Club, and around the country there are other bodies. And it's just grown in recognition, and it's part of the community.
Yeah, absolutely, and it's an ownership, and just what's jumping out for me. Then, we're evolving. I think our country is evolving to be more active outdoors. Absolutely, you see it's very visible across the country. Parks, forest car parks, overflowed with traffic over the last year or so. But it's a real opportunity now to embed programs like this, maybe in the new National Outdoor Recreation Strategy, as a model, as an exemplar of how to, I suppose, rebuild communities and rebuild communities through people and through agency support. I had a question, Clive, just jumping back to yourself, maybe just on evaluation, if that's okay. This time, I won't say this time last year, but in February 2020, we met up in Maynooth. We had a national gathering indoors a long time ago now. But some of the findings from the previous method of evaluation, Clive, you might just talk us through those for a second. So just if there's somebody here that wasn't there that day, just to share some of those, and maybe the new model of evaluation that you're proposing through Go Green Roots, and what that will do that the other evaluation didn't do.
Yeah, look, it's quite telling, by hosting those wonderful meetings with Mental Health Ireland in Maynooth. I moved to Maynooth University, so thanks for the carrot there. Look, I'd like to say the nature-based, what we could generally call nature-based therapy, which Woodlands really fits into that into that sector. It was just an immense shock scientifically to look at the the impact it had. And we were able to capture that, very well in terms of, what we call consistent and sustainable increases in psychological well-being, which is, how do we measure psychological well-being? We ask people how they feel using a small number of questions about vitality, energy, etc. But much more important than some of that data that we got, is actually the voices we hear and the positive stories we hear from, from Quilta staff, from local sport partnership personnel, from boots on the ground, of their experience in supporting others on their journey. And I think that's a really nice way to look at this. This is actually, we provide a journey for people to go with facilitators, essentially, in a bespoke natural environment. So, instead of just, looking at data points 1 and 2, pre and post, as we call it scientifically, we're interested now much more in the journey. And we're interested in how people respond, a couple of days after. And I'll give you the counterpoint. If you go to the gym and exercise, it's unlikely you remember who you met there. It's unlikely you had a conversation. It's unlikely you'll even have a good recall of the parameters of your training, what we might call it time intensity, etc. But if you go to the forest, people's memories elaborate. So they remember the conversations, they remember the flora and fauna, they remember the lichen they saw on the branches. So, I think that's a really interesting thing, we're concerned with, is how do we capture people's, it is technically, we're looking at what's called time cessation effects, but how long does this effect last? So we're able to look scientifically at much more interesting questions. And we're also able to look at the kind of richness of experiences. And to do this, we do 2 things. One is we do this kind of momentary sampling. So we sample people a couple of days afterwards. They'll get a message and say, please reply, answer these couple of questions about your experience from last weekend. And by doing this with a large number of people over time, we're able to understand, the undulations of the experience, the richness, and that tapestry. And much more, we're actually going to be interviewing the support staff and personnel. And we're really interested in what's it like to be enabling another person on a journey. And the evidence for that, wide-scale research in psychology, is that this is a huge benefit to the enablers and facilitators. And that means that literally the boots on the ground in the forest, they cherish this experience. It becomes, often a pivot point in their lives to help others on their journey. And that's, a voice who we'll be able to amplify through our new model of research. And I guess that's a major departure from the, is it effective question. It's actually, is it, life-changing? Is it enriching? Because we already have established, and much other research around the world has established, that it's not only is it effective, but we're pursuing these, I guess, more meaningful questions, about, what do people go on to afterwards, the kind of follow-up, and also to know how the volunteers experience that their stories can be told, because that's an invaluable story, especially as the future plans for the program are upscaling and proliferation. So I guess if we understand our network a bit better, the facilitators on the ground, that will give us a foundation from which to expand. So I would say we're wearing a different, bringing a different lens to it this year and in the future.
Excellent. Thanks so much, and I really welcome. I'm sure everybody else does here. And that qualitative piece, the story really is what it's about. We know walking works, we know walking works, but what kind of an impact is it having on somebody's lives, on their relationships, whether they be family, personal relationships, etc., etc. Does anybody want to just pick up on that? Maybe Martin, from a Mental Health Ireland perspective, evaluation, the qualitative piece.
Yeah, I think, like we were saying earlier, sometimes like a very simple idea, it can be hard to unpack, and sometimes you can even mess with it a little bit. If you try and study it scientifically, you could crush it. But I think Tig and his colleagues have done that in a very inclusive way, in a very gentle way as well. But it actually, it feels intuitive, but actually it is backed up with the science. And it's not just, I say, the enjoyment of the walk itself, but you can actually recreate that. And a number of days later, you're still getting the benefit. And it could be a photo, or as Miffy has described, just that evocative scent. something that allows you to get back into the space. And I think, as Tiger's mentioned there, if you're pounding it out on a treadmill in a gym, kind of a sterile environment, a bit artificial, you're very unlikely to remember that. You'll certainly get the endorphins, you get the benefit from it, and you're getting the fitness elements, but it's not necessarily a moment that you're going to be able to recreate. And I think, as Liam has said as well there, in terms of just those little, vignettes where people have experiences as well, where in terms of you're building new relationships, and that's really what this is about as well. We know, for example, with young people, having one good adult is important, but we know as we go through our lives, having 3 friendships, 3 different people we can connect with, we can just check in with. It doesn't have to be problem solving or anything like that. It's simply a companion that you can talk to as well. I think, as Liam was mentioned earlier as well, and even in our team at the moment, we're doing a step challenge. So we've been broken out into different teams, and the cats are certainly well ahead. What can I say?
The buffaloes, sorry, just saying.
You can see when something becomes goal focused, it can almost become work. So it's not about being competitive. And sometimes people associate with sport, you have to be an elite athlete. If you're not turning up in the Euros this weekend, or if you're not going to Tokyo, that really you're not a sports person. But it is about getting involved at the pace you're comfortable with. And that's really good to restore people's confidence, sense of what we call self-agency, where you make your own decisions and you move through life in your own way. So I think it's something that's really, really important from a mental health and well-being point of view. And that's why our team are fully supportive of Woodlands.
Just on a research element. Sorry. Yeah.
Go ahead, Charlie. Sorry.
Just on a research element, the HSE and UCD did an evaluation and a pilot study, and without that study, I doubt very much if it would have gone beyond Wicklow. It was very important to have that piece, because we weren't just walking and talking. It was being evaluated scientifically, and the benefits were significant. And I would like to thank Dr. Justin Brophy, who was on the call here today, because he was one of the researchers on from the HSE side, and the thesis was done on specifically on the benefits of woodland walking for mental health, which it's really tight piece,
Yeah, that was a powerful, and some of the findings from that study, Charlie, were very powerful actually. And they're included in that implementation document I presented very briefly earlier on, but they're all downloadable on the website, and you get those findings within that document as well. kedaranwalking.ie/woodlands for health. There's a few questions coming in, but I'm going to hang on to them for a second, because I have a couple more questions myself, and just to kind of summarize, I suppose, just the discussion around evaluation and how we link that back in to, with and through local sports partnerships. Not only are we developing friendships with people, but we're also developing relationships with the service providers. And for somebody to be able to lean on a local sports partnership development officer, has built confidence, has built self-efficacy, wants to now progress that little bit further. And it could be to, participate on a hill walking program. It could be participate on a cycling program. It could be to join a park walk or a park run on a Saturday morning, where this is a different community of people with, different interests maybe, and maybe common interests. But I think that's really, really important, that we start to, this program starts to create pathways for those participants, and we can empower those participants with obviously signposting, but also if they want to participate in further training, and they can become walk leaders in their own right, or champions at a local level, and that would be a really positive outcome for me. I just ask another question, if that's okay. And it's a program. It's a question for you personally. I mentioned it earlier. We all work in a paid capacity, other than the volunteers who help and support on the ground, and do an amazing job. And I don't think they're unsung heroes, in my opinion. But what do you, the panel, personally get from the program?
For me, I suppose it's my background with bipolar disorder. It's good to see people that have enduring mental health issues develop, and within all our research, the commentary from the participants was very important. and to see them on the programs and realize how it has benefited so much. It's just heartening.
Thanks, Charlie. Appreciate that. Anybody else?
Yeah, I think the evidence base is really important, and the scientific backup. But there's a thing that always strikes me about these things is that the word synergy, which means that the whole is greater than the sum of its parts. And that's really hard to measure, but it's a phenomenon that occurs when you get people together. And personally, as I described that conversation I had with a woman, that was just one of many. So I come away, even though I was there in a supportive role, but I come away feeling uplifted, feeling, good as well. So it's not just about, I think it's what Eddie touched on earlier on about just it's a walk. It doesn't, let's not call it a program. This is about people and people engaging in activities that support well-being. You can see over my shoulder here the 5 ways to well-being, and Woodlands for Health ticks all of the 5 ways to well-being boxes, and it's all proven that level of connection, you're connecting with other people, you're connecting with nature, you're connecting with yourself, and that's so powerful, and it's really hard to measure the ripple on effect of that. And another experience I would have had with another person I walked with who had then the next week when I was chatting to this person, they had brought one of their kids out for a walk during the weekend between the Woodlands walks. And that was really simply because they hadn't been to that forest before. They discovered that it was there and they wanted to bring their kids. So, who knows the implications of that in terms of the family dynamic and the well-being of that child, not just the parent, so it's really beyond measure what it can do. And I'm not saying that lightly. I really mean that.
I hear that coming across strong, absolutely beyond measure. Anybody else?
Yeah. I'll just be very brief and say, look, it's amazing. 12 weeks of walking can give people a lifelong window into looking after their own mental health and well-being, because this is a source they can go to. They can go for a walk in their park. If they don't get to Wheelchair Forest, they can join programs to local sport partnerships. They can just seek nature. So what we're doing actually is opening a whole window to people to find their own path to look after themselves in the future.
Thanks, Tig.
I would echo that, Tig. I was just going to say, I met a participant from a Woodlands for Health program, one of the initial ones we ran, and I was in a park yesterday in Limerick on another program, and that lady was doing laps of the park, just in the local park. She said she hasn't stopped walking since she started the Woodlands for Health program. And that's, for me, is the beauty of it, where you've taken someone from their sitting room or for whatever, gotten them to put on their runners and go for a walk, and 2 years down the line you meet them in a park and they're still walking. That's
brilliant. Powerful stuff. Yeah.
I suppose we live in a very noisy world. Like, from the moment the clock radio comes on in the morning, and there's sound and music and conversation and WhatsApps and Zoom calls and whatever else. So what I particularly like with Woodlands is that you're outdoors in natural habitat, but you're meeting people. You've enough in common that brought you all to the same place, but you're different enough to have something to say. So every time I've met really interesting people who are curious and passionate and have ideas, and you can just explore that and just let go of all the other noise that's in our lives as well. So just to enjoy that moment. And I suppose the fact that people just create that little space, saying, whether we call it me time, but it's a shared me time. And that really works well. So I think I think that's what I've always enjoyed. And you do come back, feeling refreshed and just kind of pressing the reset button. I think Woodlands helps do that.
Excellent. I have a couple of questions. Sorry, Charlie. Yeah, go ahead.
It's all about community, and without the community mental health nurses and the inertia between the nurses and the participants, the walk leaders would tell me that they've benefited every bit as much as the participants. So all round, people benefit, and it's great to see it, and it's great for communities. It's building communities.
Yeah, I think absolutely 100%. That's coming across really, really strongly. Community. There was a couple of questions came in from our audience, and I'm going to get to those in a second before we're nearly close to wrapping up. But there was one question, and this was coming up over the last couple of years for us as a national steering group, and this was around the fidelity of the program. And the fidelity of the program is hugely important. It is a little bit, let's call it spade a spade. It's a little bit more complex than their general active community walking program because there's more partners involved. And those, like I give an example of the transport, for instance, getting somebody from A to B is an important part of the program. Whereas if we expect them just to turn up, we may not get that adherence to the program. So like transport is just one example. And look, we've created these documents, nationally implementation guideline documents. Again, they're just guidelines, they're guideline documents, but we hope that they would support local rollout. So just around program fidelity, it's really important, in my opinion, to maintain that program fidelity, that all these program components that make Woodlands for Health a success are maintained. Without shaking a stick, it's a carrot. We have the documents, we have the resources, we want you to use them, and we want the program to continue to be successful. But there's always a challenge, that this program can be watered down, broken down, have some elements, some not. It's called Woodlands for Health, delivered locally, but it doesn't tick all those boxes. Just to spend a couple of minutes on that, and only a couple of minutes. Maybe Martin, you might just pick up this and just start with that.
Yeah, I think it's important to say that the program has evolved over time, and like we've learned things that work well and things that didn't work so well. So people have kind of shared all that, and I say having the expertises in terms of safety around the forest, that you're not going into a forest when it's about to be harvested, that people don't overextend themselves, that people take proper dress, etc., have an opportunity to have a snack, and that the supports are there. We work very closely with HC on a whole range of different programs in promoting positive mental health and in paths to recovery as well. So so just all that support is there, and it's really important that works well. And I think the leadership has been really important. As you can see today, in terms of Jason's agency around Get Ireland Walking, have played a really important role here in making sure that this all happens and we come together. It's synchronized and it's well supported there. And there's that great phrase about leadership. It's first through a forest, last through a bog. So if you're going to go into a forest, it's probably a good idea to get to the front because the branches come flying back. If you're going to go into bogland, it's probably useful to know who's been there in front of you. So all of the partners have learned from, this is extra boggy, don't go there, this is more helpful. So it's about being able to share that, and the implementation guidance and the website, we're trying to be generous with that. But if you begin to remove some of the active ingredients, you're not going to get the full benefit. You'll certainly get some benefit, but if the program is cut short, or if it's not happening in a woodland setting, or if you don't have the guidance and the sports, you don't have the local sports partnerships involved, or mental health volunteers or development officers, you'll have a good experience, but you won't have the fullest experience which the Woodlands for Health program can deliver. So we'd really encourage people to stick with the program, certainly innovate, and we want that feedback, and that's why we have continued evaluation. So when we happen upon new ideas like Miffy has described earlier, we can incorporate them and share these around the whole network so everyone gets the full benefit. So it's I think it's important just to innovate, don't be stifled, but try not to delete out some things that we know really contribute to success here.
Okay, appreciate that. Thanks. Is there another one?
Yeah, Jason, there's actually even a reason for the duration of the program, right? So that's literally based upon what we know about habit formation. We know it takes at least 60 days to form a habit. So we try, provide sufficient period for people to have this built into their weekly schedule, so that it becomes something which they don't even think about when they're doing. They just put on their runners and go to it. And I think that's part of, there's a backstory, or I'd say a blueprint underlying this nature-based therapy, which we don't have to spell out all the time, but that means that it's actually designed to really meet the needs of the participants.
Great. Okay, look, we're nearly there. I think we could this is a webinar. I think it'll go on for a day. I think we could do it justice over a day, to be honest. There's so much to discuss. Just a couple of things before I wrap up, and I'm going to ask one more question. There is a survey link at the bottom of your screen, the chat function, and we'd be fantastic. We get that feedback from yourself of the experience of the morning, if you're interested in getting started on Woodlands for Health, which poses my next question. Before I introduce a short video that will see us out. Give it to me in 3-4 steps. I want to start Woodlands for Health. I'm a practitioner professional in a county Navan. How do I start?
From an LSP point of view, anyway, you're looking at talking to you first, Jason, to get a few quid to get it off the ground, and then identifying your local partners, your mental health services, and going from there. Like, you don't have a Woodlands for Health initiative without the participants, and the participants are being referred from those services. So for me, that's your first point of contact, and exploring that, and then going from there in terms of your location, your transport, your refreshments, your Quilta working leader, massively important for that knowledge around the flora and fauna. And even Miles, I don't know if he's online today, but he brought his guitar along a couple of days and we just sing song at the end of the walk and stuff. So, you know, each going back to the fidelity, each component is vital. Every little component brings its own piece to the initiative, and that's what makes it such a good initiative, in my opinion, anyway.
Thanks so much for that, Liam. I think that captures it all in a nutshell. I want to thank you, the panel, for joining me and us today. Thank you so much for your insight and for answering the questions openly and honestly. And like I said, I think we could do this. We've spent 2 hours here this morning. I think we could talk for 4, 6, 8 hours, no problem on this. So I'm going to invite you to leave the screen if that's okay.
Just Jason, before we go, yeah. Jason, I want to endorse what you just said. But events and webinars like this don't just happen by accident. There's a lot of hard work involved, and I'd like to thank everybody that's involved with the work that's been done, particularly Linda Sankey and Sonia Rennick, and among others. So it helps to make my work easy in promoting this within Quilta, and much appreciated.
Thanks, Charlie. You have to save me a little job there. I was just going to do all that. And I know I would have forgotten somebody. But yeah, look, we have a team of people in Get Out and Walking, and our partners across the board. There's just too many to mention. But Linda Sankey, you mentioned, Charlie works very closely with me. And unfortunately, she couldn't be here with us today. But yeah, absolutely. So many people involved. So many people make this program a success. And we continue to make it a success. Can I thank all of you guests for joining us today? Just to remind you of the website, getoutandwalking.ie/Woodlands for Health. Jump onto the website, find a little bit more about find everything you need to know about Woodlands for Health. All those documents are downloadable using those hotspots on that interactive web space. And please not to forget Woodlands for Health Reboot hashtag or Woodlands for Health hashtag. If you could share those across your social media platforms today, we would be most grateful. I mentioned there earlier the chat box. And that webinar survey link, you could get on that. So I want to wish everyone a fine weekend. Thank you so much for joining us. And encourage you to take a woodland walk, either not today, maybe over the weekend, and just take some time to sit down, reflect. And that word reset, I think that's so important. And I want to share a short video with you by former President of Ireland, Mary McAleese. So thank you, go well, have a fantastic weekend.
Isn't this place absolutely beautiful? It's one of many little quilcha forests all over Ireland. There are hundreds of them, and they're on your doorstep. And Quilcha have got together with Get Ireland Walking, with Mental Health Ireland, with Sport Ireland, to create this 12-week wonderful gift, a free gift, saying to you, come on, get out, come for a walk. And over those 12 weeks, you'll be introduced to new places, new friends, new experiences, the joy and the wonder of nature. Just look at it, it's glorious. And you'll probably sleep better, you'll eat better, you'll have a nice lunch at the end of it, you'll have a great set of memories. Cost you nothing. These are walks, gentle, gentle walks. They're not frog marches now, so they're easy. Come on, join in. You'll really, really enjoy it, and you'll have a wonderful set of memories.